Mental illness is something that affects lots of people. Over 10% of kids, which is almost 84,000 kids in BC, are affected.
For a growing number of youth within our communities, managing home life, schoolwork, and relationships can be overwhelming. Support services in the community play a key role in forming solid foundational assistance, but for some, more support is needed to create a positive and lasting change.
Some teens can be going through psychosis, which is when their thoughts and feelings don't match up with reality.
Over the last 10 years, the Adolescent Psychiatry unit at Kelowna General Hospital has been providing this support, offering specialized care focused on collaboration, not only between the youth and staff, but also with family and community resources.
They may have already been diagnosed with a mental illness, or they may be just really not coping well, and so they come here to have a full assessment by our team to see where they're doing well, where they need some help.
I think creating a non-stigmatizing kind of approach and environment is all part of the recipe for keeping young people on track to getting back where kind of development came off the tracks, getting back on those tracks.
We really want to make sure that the youth and the families' voices are heard while they're on the unit. We want to make sure that their values and beliefs are considered in terms of how we follow treatment that's going to work for them. So we really try to follow a patient and family-centered model.
The length of stay for youth can range anywhere from 10 days to several weeks. Designed to create a positive environment, the unit offers multiple activity areas as well as a classroom where youth continue their studies and are tailored to the school programs they'll be returning to following their stay.
A lot of the students that we have, they have anxiety issues, and if you don't continue their schooling when they come here, when they go back to school, they're going to be further behind, which is just going to exacerbate their anxiety when they go back to school.
With a diverse staff specializing in supporting positive mental health for youth, the goal is not to provide a cure, but rather a comprehensive assessment, allowing staff to provide treatment plans and recommendations for the youth, their families, as well as other community support groups.
We think we know what's going on with them, but oftentimes there are pieces of that puzzle that have been overlooked. So part of what an APU admission can offer is getting more of the puzzle pieces together and putting it together in a meaningful way that makes sense to families and that makes sense to the clinician and the referring community, so that the more we understand, the more we can help.
We want to be providing some leadership and some direction and some support really to the communities out there that are all really working really hard to manage their needs locally. So it's nice to be kind of part of that process.
For more information on the APU, visit interiorhealth.ca/find us. Reporting for Go Okanagan on Shaw TV, I'm Brendan Osborne in Kelowna.